Thank you for hearing testimony this afternoon, Senator Campbell, on committee. I have written testimony, but I'm going to edit it a little bit because a lot of things have been said, and then I want to respond to a couple of things that were brought up as well. My name is Heather Swanson, Heather Swanson. I'm a certified nurse midwife and family nurse practitioner from Wilcox. I currently serve on the National Board of Directors for the American College of Nurse Midwives as the Region 5 representative, which covers 15 states and includes Nebraska. Nationally, ACNM is in strong support of legislative and regulatory efforts that protect the full scope practice of certified nurse midwives, and likewise are supportive of efforts that resolve the existing restraint of trade statutes and tactics that still exist in our practice. ACNM supports CNM attended home birth, and thus ACNM supports LB 712, and a letter of support from ACNM was emailed to the committee last week. I'm also a member of the Nebraska Nurse Association and was asked to present their supportive testimony today. You've just received a letter from NNA that includes the following. Certified nurse midwives in the United States are prepared in two healthcare specialties, midwifery and nursing. The nurse portion of their credentials aligns them with nursing, and they are recognized as one of the advanced practice nurse professions. On the national front, the American College of Nurse Midwives is an organizational affiliate of the American Nurses Association, and a partner together to support the practice of nursing as a whole and the unrestricted practice of APRNs. ANA supports the removal of barriers and discriminatory practices that interfere with full participation by advanced practice registered nurses and the healthcare delivery system. ANA supports initiatives that remove arbitrary practice restrictions or prohibit policies that promote barriers for APRN practice, education, abilities, and competence. Consistent with our national organization, the Nebraska Nurse Association is supportive of policy changes and legislation to eliminate barriers to APRN practice. Like other APRN types, certified nurse midwives have experienced unjust practice restrictions across the nation and here at home in Nebraska. Specific to this bill, our membership includes those who have been restricted from full-scope APRN practice by prohibiting certified nurse midwives from attending home births. NNA acknowledges that Nebraskans who are currently choosing home birth are limited to unlicensed and unregulated care providers. Lack of licensure and regulation are known to carry risk to women and families, rather than securing a licensed and regulated home birth provider like a CNM. This gap is one that CNMs can fill to improve patient safety, as it is within their trained and certified scope of care. NNA supports LB 712, which eliminates the restriction of CNM-attended home births. The Nebraska Nurse Association urges your support of this measure and future support of unrestricted full-scope APRN practice across Nebraska. Thank you for your time and the opportunity to testify on behalf of the nurses and NNA members. With whatever time I have left, I would like to speak on behalf of myself. A couple things that were brought up, a question about supervising language that has been interpreted as being readily available by phone. So it doesn't have to be somebody there present, they have to be available by phone. So let's to clarify that point. You may have, I'm expecting that somebody will probably mention that Nebraska is rural and is not an appropriate place for home birth to happen. And I would urge you to consider states like Montana, Texas, North Dakota, Wyoming that have all had home birth going on for years, and some states that have expanded beyond nurse midwives to allow other types of midwives to attend home births. And what we see in states that are more rural is that there's a higher non-urgent transfer rate the further away they are from a hospital. So they practice a bit more conservatively. They transfer sooner, they risk out sooner as well for care. So that's how safety naturally kind of gets preserved in rural areas. As well, I'd like people to take note that we do have two growing Amish communities in Nebraska. One's down by Pawnee City, and I had the opportunity to spend time with them a couple years ago to listen to their concerns about not having access to nurse midwives. There's also a group in the north, kind of central part of Nebraska. They still don't have midwives to take care of them, and they are not going to the hospital, and I think we need to provide care for them. I got contacted initially from a midwife in Ohio who was caring for some moms who were traveling out here and relocating, and she was shocked when she found out they couldn't have a midwife there. Also, if you don't mind, I'm going to pick up more points here. Safety is always a big concern, and opponents will bring up that we don't have a lot of randomized control trial studies on birth location, partly because it's unethical to tell somebody where they can birth. Like, you're in labor, great, you get randomized to go home, you get randomized to go to the hospital, because we know that women are going to labor best where they feel the most comfortable and where they choose to labor. The studies that do compare birth locations take women with the same demographics, so same age, same risk factors, and look at their outcomes based on where their intended birth location was. So if their intended birth location was at home, even if they transfer to the hospital, they include those outcomes in the outcome data and analysis of that. Now, a few studies will probably be mentioned that will be opposing or supporting opposition to home birth and the safety of it. And I want to point out the two big ones, which are the Pank study, which is a Washington State study. The title and the study as a whole claimed to look at planned home birth and unplanned home, or planned versus unplanned home birth. At the time, they actually got data from the birth certificates, and the birth certificates did not distinguish between whether it was planned or unplanned. That data also included data on births as early as 34 weeks, which is preterm, which no wise nurse midwife would attend a home birth that early at home. Another study that's come up is the WAX study. That study also has several flaws to it. Only three of the studies included in that meta-analysis actually differentiated between planned and unplanned. Of those three studies, they comprised 93% of the women in the study, and if you just looked at data from that, it showed no increased risk in adverse outcomes. So additional outcomes were included to skew those stats. Across the world, home birth happens. In Canada, if you're low to moderate risk, you have to be offered home birth, and you work together in a healthcare team. So if you need to be transferred, then you go into the hospital and somebody welcomes you and doesn't treat the midwife poorly or the family poorly. I do think home birth can be appropriately done in Nebraska. I teach at a college of nursing here, but I also work as a clinical director at a clinic and freestanding birth center in Texas during my free time. And I'm also a doctorate student, so I don't really have any free time, but in the midst of things, I attend birth out of hospital. And though I practice in the hospital, and I like that, there's something nice and convenient about it. The cleanup's a little bit easier. Nurses help you out with all that. Birth can be done out of hospital pretty much just the same as it is in the hospital, minus having an OR there. And there's things that we can risk women out for in pregnancy and then in labor to get them to the place where they need to be. And we have emergency medications to treat hemorrhages. We can deal with shoulder dystocia if there's meconium. Birth now looks a lot different than it did 30 years ago, 40, 50 years ago. We have medications now that treat a lot of the biggest concerns that we had with women, which were postpartum hemorrhages. So I beg people, and I need to cut it off, that safety, if that comes up, it's not unsafe. In the 407 review that happened, there was, of course, 2 407 reviews.
We need to finish up here.
I know. The last one I want to speak to, though, because I was on the 407 review. I'm very sorry, because I know it's not polite to go long. But the last 407 review, I was a part of it. I did not think that it was I felt very strongly it was a biased decision that happened, and that people voted not on the evidence that was presented, but on their own personal feelings. And so if the 407 review gets brought up, I would beg you to consider that it wasn't representative of the evidence there. Thank you. I appreciate it.
Questions from the senators? Thank you, Ms. Swanson, for your testimony. Our next proponent